In recent years, the abortion industry and their supporters have been pushing the narrative that legal restrictions on abortions will prevent mothers who are suffering from pregnancy complications from getting necessary medical care. Is it really true that laws protecting preborn children from abortion are dangerous and harmful to women? Is it true that if abortion is illegal, women will die? Specifically, we hear that women will die because they will not be able to access medically necessary abortions for complications such as sepsis, or treatment for miscarriage, or treatment for an ectopic pregnancy when the embryo implants outside the uterus. But none of these claims about the danger of pro-life laws are true. Pro-life laws only serve to protect the lives of innocent preborn children and pose no threat to the safety of women. It is never necessary to intentionally kill a preborn child to protect the health of a pregnant woman, and treatment for miscarriage and ectopic pregnancy remains legal in every state. Some of the confusion comes over the usage of the word abortion, since miscarriage is sometimes called spontaneous abortion. But pro-lifers are not against the word abortion, we're against the act of killing. If someone uses the word abortion to refer to something that is not intentional killing, then that's not what pro-lifers are talking about. In the first trimester, abortion pills are taken which cause the baby to starve to death, or a suction device is used to suck the child out of the womb in pieces. In the second trimester, the child is dismembered with forceps. And in the third trimester, the child suffers a lethal injection with poison. The defining feature of these abortions is that the intent of the act is to kill the child. Miscarriage doesn't fall into this category because they are unintended by definition. Some will say, but the procedure used to remove a miscarried baby can be the same procedure used in an abortion. The difference here is that in a miscarriage, the baby has already died before the procedure starts, whereas in abortion, the baby is being intentionally killed. Some will also argue that doctors may be hesitant to provide miscarriage treatment for fear that they will be prosecuted for abortion. But if a doctor doesn't know the difference between a miscarriage and an abortion, that individual should not be practicing medicine. What about ectopic pregnancies? When a child implants outside of the uterus, sadly, the child cannot survive, and it's a life-threatening situation to the mother as well. She requires immediate medical intervention to remove the pregnancy. But this is not the intentional killing of that child. The child must be removed from an environment that is immediately physically hostile to itself and to the mother. And sadly, there's nowhere for the child to be safely implanted. And as I mentioned earlier, ectopic pregnancy removal is legal in every state. What if the mother develops another life-threatening complication such as sepsis? In truly life-threatening scenarios, sometimes it is necessary to deliver the baby early, and early delivery may threaten the baby's life, but this is not intentional killing, and these procedures are also legal in every state. In my many years practicing as an OBGYN physician, I have spent thousands of hours caring for pregnant women, delivering babies, and caring for mothers who have sadly lost their children. I have never encountered a situation where abortion was necessary, period. It is important to call out the abortion industry's strategy here, because what they're doing is not simply deceptive, but deadly. By spreading these lies, the abortion industry is actually trying to scare doctors away from providing legitimate medical treatment. If they can successfully scare doctors this way, then women may be denied care, possibly suffer or die, and then the abortion industry will continue to use their tragic stories to blame pro-life laws, when the actual cause of death was pro-abortion lies. We must have truth and clarity on this. The lives of children and their mothers depend on it.